If you think about it, every day of our lives, we plan and prepare for different things. We plan to go to work, to go to school, for an interview. So why not plan our medical care? Why not prepare in advance for an unexpected medical event?
Took care of a couple that they were both 87 years old, and the husband had a stroke, was brought to the hospital, put in the ICU on a ventilator, and his wife came in and immediately burst into tears. And I said, I know this is overwhelming. I know this is really awful for you. And she said, you know, we promised each other we would never let this happen, but we never wrote it down.
We often think that engaging in advanced care planning should be left for the end of life, which couldn't be any further from the truth. We want to plan and discuss and explore what our own wants and needs are before we get to a point where we can't.
Advanced care planning is important at any age, and we need to be prepared for the unexpected. Anybody who is 18 years or older should have these important conversations with the family members.
It brings you that peace of mind that your wishes will be honored in the case that you're unable to speak for yourself.
Unexpected medical emergencies send ripples through families. Various emotions, anger, frustration, sadness. However, with advanced care planning, it would make decision-making easier.
My father, he was 83 years old. He had a stroke. We thought that he was going to come back from the stroke because he was getting ready to go to rehab, and he hadn't had any previous illnesses. Then with him having a seizure after the stroke, it left him incapacitated. By him not having an advance directive, it put a lot of stress on the family as to making decisions, and the decision of what medicine to give him, or if he wanted to have this feeding tube, or if he had an advance directive, then it would have been a plan for us to follow as to what he wanted for his health care.
It's important to have a person, one person, designated that you trust to carry out your wishes. You may tell all of your family members what you want, but making sure that one person can say, in that moment of crisis, this is what he or she wanted, this is what I'm telling the doctors, and this is what I expect the doctors to do.
If I'm in a car accident tomorrow and I'm unconscious, who's going to make my decisions for me? Just identifying that person is a huge step in getting this process started.
It actually is quite simple. We have very good tools for you to use, lots of people who can help you with the process. I think people are more nervous about thinking about it and about thinking about doing it than the process itself. And I've had many patients tell me when they're done, they feel so much better now that they've done it.
For patients who are on dialysis, the social workers are an incredibly valuable source of getting this started, talking with their physician, and it does take time.
As a social worker, I recommend to first reflect on their goals, their values, what brings quality to their life, their beliefs, to think about what medical care is acceptable for them and what is not. Remember that as a patient, you are a very important part of this team. So take control of your care planning.
I am a registered nurse and I have an advance directive.
I'm a physician and I have an advance directive.
I'm a social worker and I have an advance directive.